Well, that's quite a broad church. It includes herbal medicinal products. It includes non-hormonal prescribables, so they're medicines that you have to get on prescription, but not hormonal medicines. These are normally medicines that have been found by serendipity, blood pressure tablets or antidepressants that actually help with sweats and flushes as well in lower doses. And then there's lifestyle measures and cognitive behavioural therapy, and obviously relaxation techniques and Pilates, and which we'll talk about a bit later. Well, I wouldn't say that. I wouldn't take it instead of HRT. On the whole, HRT is incredibly successful and very effective, and we've got good studies to show that. I would say that there are some women who can't have HRT. They've had breast cancer, or they've had first-degree relatives like mother or sister or grandmother with breast cancer, or they've got the BRCA gene, the BRCA1 or 2 gene, which makes them much higher risk than the rest of the population. But great Auntie Ethel twice removed, that's not going to be a problem. There are some women who choose to have a more natural approach. They would be medicalised. And there are some women who've been successful on HRT in the late 40s and right through the 50s, but by 60 they want to stop. And you try and seamlessly move them from a reduced dose of HRT onto something else, maybe a herbal medicinal at this point, because they're afraid of symptoms returning if they stop and go cold turkey. Well, the answer to that is no. I mean, the gold standard for a doctor is what we call a grade A study, and that's a randomized control trial where you're taking the active ingredients, be it herbal or HRT, against a sugar tablet placebo, but it should be double blind. You shouldn't know what you're taking, the doctor shouldn't know what you're taking, and so you can objectively analyze the data without bias. There are very few studies in the alternative market, and they're usually short studies, 3, 6 months, 1 year duration, small groups of women, 20, 60, 100 would be a good group. That just doesn't compare with the big studies we've had on HRT. The Women's Health Initiative study, albeit it had some flaws, with the women who had a womb on estrogen and progestogen together, 16,500 women followed up for 5 years. And the hysterectomized women who only needed estrogen, no progestogen, 10,000 women followed up for 7 years. We don't have that magnitude of data. So it's not as effective. The other thing is very few direct comparisons. One study comparing an antidepressant, venlafaxine, with estrogen, both were better than the placebo, but estrogen was quicker and more effective. So we know on a head-to-head that estrogen's still better, but some women can't have it. So it's good to be able to offer them something. Generally, one would have to say they're safe, but there are side effects. And herbal medicinal products may be not as safe as you might have thought. You know, we always said it never does any harm. It might not do good, but it doesn't do harm. In fact, there are drug interactions and side effects. And the biggest culprit for drug interactions is St. John's wort. It speeds up metabolism of other drugs in the liver, and so that they're not in your system so much to do good. Some people who've had organ transplants have ended up with organ rejection because their immunosuppressants were metabolized too quickly. And if you're on anti-epileptics, you might get fits if it's metabolized too quickly. If you're on digoxin or warfarin, I mean, these are big medicines, and women in their 50s and 60s might be on them. And there are drug interactions with other things like ginseng and dong quai can affect warfarin and aspirin and cause bleeding and bruising. And there's side effects. Black cohosh can cause that migraine type of side effect, you know, nausea and vomiting and headache and dizziness, and some others cause leg swelling, edema. So the herbal medicinals do have some issues. They're not without problems. And the non-hormonal prescribables, clonidine is a blood pressure tablet. If in certain people with naturally low blood pressure, it can make you quite dizzy. If you stand up suddenly, you go lightheaded, that's postural hypertension. And if you start clonidine and stop suddenly instead of coming off gradually, you can get rebound raising of your blood pressure, rebound hypertension. So that's got to be looked at. You can get drowsiness with gabapentin. You can get nausea and dizziness with some of the other antidepressants like sertraline or venlafaxine that can affect your libido. Venlafaxine not as much, but fluoxetine and sertraline, yes. So there are side effects, but they're not terribly serious. But I did flag up the herbals because it's so easy to assume they're totally innocent, and sometimes they're not. Well, if you've had breast cancer, I would steer off isoflavones, which is soya and red clover. They're estrogenic. Their molecules are really similar to estrogen. In theory, they'd be okay because they only affect one type of receptor. There were 3 estrogen receptors. They only affect beta receptor, so they should be breast neutral. In practice, they're just so similar, we don't. And there are some herbals like ginseng, which again are very estrogenic, so I'd steer off them. If you had breast cancer and symptoms you couldn't control with lifestyle measures, I'd try clonidine or sertraline, fluoxetine or venlafaxine. Again, a caveat, if you're on tamoxifen, sertraline, citalopram less so, fluoxetine, they can enhance your drug metabolism. You don't want to speed up your metabolism. In theory, if you get rid of your tamoxifen too fast, you'll have recurrence. So I'd have venlafaxine because it doesn't hit the liver like that. It doesn't hit the liver enzymes. Gabapentin, those are the ones I'd choose if you had breast cancer rather than the herbals. Well, I wouldn't use alternative vaginal preparation. I know there's Vagi-Soy and Vagifem type products that they're not. Vagifem is estrogenic, but there are soya products for the vagina. And there's an oxytocin called Vagitocin. Oxytocin helps with production of milk when you're breastfeeding, but it's been marketed, isolated and marketed as a cream because it seems to help the vagina. But that's really very, well, cumbersome when you think about it, because most of the estrogen vaginal preparations, be they ring or pessary or tablet, are not absorbed into the main bloodstream. They don't affect the womb lining. They don't cause bleeding. They don't cause cancer. And even some breast cancer patients who can't have mainstream HRT patches or tablets can have vaginal estrogen, albeit the watered down estrogen, not estradiol, which is the strongest estrogen, but estriol, which is a weak estrogen. One cream is 0.01% of estriol. So that's 0.001% of a weak estrogen. So they're not going to cause problems. If you're on aromatase inhibitors, oncologists don't like that. If you're on tamoxifen and anti-estrogen, no problem. So most women, and certainly non-breast cancer women, should be having vaginal estrogen products because they're safe and not looking for alternatives. Cognitive behavioural therapy is what we call a talking therapy. It can be one-to-one with a counsellor or psychotherapist. It can be group therapy. There are apps now. You can teach yourself books. And it's really to improve your mental approach to your symptoms. It doesn't take your problems away. It was mainly used in mental health, particularly for anxiety and panic attacks. But there is evidence now it helps with sweats and flushes. It doesn't take the symptoms away, but it helps you deal with them better because it breaks it down into bite-sized bites so that you can digest and cope with it. Like, I'm stopping smoking. I will never have another cigarette again. That's a biggie. But I'm not going to have it today. And then the next day, I'm not going to have it today. Day by day approach. This is similar. It deals with the here and now. It doesn't look at the past. It's not psychoanalysis. It helps you deal positively with your symptoms so you cope better. The principle being that emotions and moods feed in to physical sensations. And if you're negative thoughts, you can go into a vicious circle. So if you can learn to deal with things positively, sometimes, if you're in public life, you're lecturing or you're a stockbroker or you're at a meeting and you know you're going to get wet patches under your arms and sweat pouring down your face, you get panics and you get anxiety. That negative side of it, CBT will help so that you deal with the actual sweat better. Go and sit near a window, change your clothes, things like that. Well, there are a number of things you can do to help yourself, and women like to feel empowered. You want to know what you can do to help yourself. Often it's what I call a therapeutic alliance. You do what you can to help yourself, and if it's not enough, the doctor or nurse has to prescribe something to help. So you meet in the middle. But it's good to know you've done something. So wear clothes in layers. It's common sense, wear a shirt, then a cardigan or a waistcoat, then a jacket and a scarf or whatever. So you can peel layers on and off depending if you're hot or cold. Wear clothes that like linen or cotton that are natural and breathe, not polyesters that can draw. Sit near an open window. Communicate with colleagues, bring it out in the open, saying, I'm having a problem here. Can I sit near the window or by the corridor where there's a bit of a draft? Agnes might not want a draft on her back. You might be pleased to have it. So come out, come clean. Relaxation techniques like Pilates, general cardiovascular workout, weight-bearing exercise like walking or jogging for your bones. Diet, of course, is good. Not smoking, trying to lose a few pounds. That will help your sweats and flushes as well. There's a lot you can do to help yourself, but sometimes it isn't enough and you might need a bit of help.